I had a day recently where two different people in two totally separate conversations used the word kumbaya to refer to the approaches that folks were using to try to help them with their mental health. And it inspired this video, which is going to be about superficial approaches to mental health. My name is Dr. Park. I'm a psychologist for youth, and here at Through the Waters, we nurture youth mental health. In general, I try to share in these videos what is helpful, what is beneficial, what is equipping for people when it comes to mental health. I don't talk a lot about what's unhelpful, so maybe this video is an exception to that. And like I said, it was inspired by just the theme that kept coming up in my conversations with people where two of them in totally different conversations use the word kumbaya. So I've been disheartened lately to hear from a few people that their encounters with mental health services have involved approaches that were either unprofessional or were taking, like they said, a kumbaya approach. What they meant by the word kumbaya is that it was very superficial help that was sending the message of just take better care of yourself. I'm okay, you're okay. Take a bubble bath and everything is gonna be all right. Too touchy-feely, not getting to know them as a person, not going deep enough for long-term healing. In the words of one parent that I talked to, her teen was suffering terribly, and the initial help they received was like, in her words, it was like giving a Band-Aid to someone who has a broken arm. Ironically, related to this word kumbaya, I looked up the lyrics for kumbaya for the first time in writing this video, and I learned that the word kumbaya means come by here, and it's an entreaty to God to please come help folks who are being oppressed, people who are crying, singing, and praying. So that's painfully ironic that a song about crying out to God for help in the midst of oppression has come to mean we're gonna hold hands and have a superficial time singing around the campfire, and then everything is gonna be all better. I'm not sure what to make of that, except to say that I find it heartbreaking that people who truly are experiencing what I see as an oppressive level of suffering in their mental health are having encounters with the mental health system that are superficial, unhelpful, dismissive, or unprofessional. I'm also not trying to come up in here and act like I'm any better than other people who are mental health professionals. I'm not any better than anyone else, and I'm sure I've made these same mistakes and other mistakes in trying to help people as well over the years. However, I want you to know that if you seek out help and it's kumbaya or superficial or unhelpful or dismissive or unprofessional, or it just doesn't connect with you, it's not a good fit for you, please know that there are other approaches, there are other professionals out there with whom you can have a different, deeper, more healing experience. The most important piece is to find someone who is a good fit for you, who you can trust and feel safe with. A secondary piece that's also important is to see whether that person has the expertise and training that fits with what you're struggling with. For example, I've learned that I'm a good fit for people who are struggling with anxiety, depression, or trauma. I'm not as good of a fit for people who are struggling with ADHD, substance abuse, eating disorders, or autism. Every mental health professional has different areas of expertise, so you want to make sure whoever you connect with has training specific to what you need help with the most. I could say a lot more about navigating the systems of mental health, and if you'd like me to make a video about that, let me know in the comments below. If you found this video valuable, please click the like and subscribe buttons so that you will be notified of our future mental health tips and education, and also so that YouTube will share this video with others who could benefit from it as well.